Hey everyone, let's jump right into today's explainer. We are breaking down a comprehensive blueprint that is designed to completely transform mental health care across the African continent. We're talking about a venture that takes something traditionally complex, expensive, and, let's face it, pretty heavily stigmatized, and turns it into something accessible, normal, and totally empowering.
So, I want you to imagine something. What if continuous preventative emotional support was literally as easy to access as firing up your favorite show on Netflix? Think about that for a second. Right now, mental health care feels like this super exclusive luxury item. But what if it was just a normal, everyday part of your routine? A totally predictable subscription that you manage right from your phone.
Here's our roadmap for today. First, the African mental health gap. 2, Netflix for emotional wellness. 3, the business blueprint. 4, following the money. And finally, 5, risks and continental scale.
All right, starting off with Section 1, the African mental health gap, uncovering the hidden crisis.
Look, the old way of doing things just isn't working. Right now, people usually only seek help when they hit an absolute breaking point. We're dealing with way too few therapists, astronomical out-of-pocket costs, and some really heavy social stigma. But the new way, it completely flips the script. It means continuous access, affordable subscriptions, and preventative care that's designed to stop a crisis before it ever even happens.
And the demand for this new way is proven, and it's growing incredibly fast. We are talking about modern, young Black professionals dealing with massive urban stress, students trying to navigate their futures, and entrepreneurs grinding it out in high-pressure economies. They absolutely need the support, but they need it on their terms. It has to be culturally adapted, and it has to be right there in their pockets.
Moving on to Section 2, Netflix for emotional wellness. Think of it as a gym membership for the mind.
So let's break this down really simply. Instead of paying a massive one-time fee for a single one-hour session, users just pay a predictable monthly or annual fee. Like I said, it's a gym membership for your emotional health. And that single fee unlocks an entire ecosystem. You get continuous access to therapists, support groups, and even AI self-help tools.
But wait, the crucial thing to understand here is that this is not just another piece of software you download and forget about. The vision is way bigger. It's about building a culturally adapted African mental health institution. It attacks the 4 main barriers head-on. It provides access, creates affordability, spreads awareness, and most importantly, it builds trust. That is how you actually improve long-term wellness outcomes.
Let's dig into Section 3, the business blueprint, the multi-layered engine.
Okay, let's get into the actual mechanics. If you're building something this big, you really need a multi-layer legal structure. Think of it kind of like building a house. Step 1 is the holdco, or holding company. That's like the deed to your land. It holds the intellectual property and protects the equity. Step 2 is the tech opco, which actually runs the software. Step 3, and this is vital, is clinical services. This handles the therapist networks and healthcare compliance. Setting it up this way safely separates the clinical liability from the tech side, and Step 4 is an optional foundation arm for research and grants.
And you've got to protect what you build, right? Intellectual property, or IP, is incredibly important here. We're talking about the software code, proprietary algorithms, the educational content, and the brand itself. Because over time, as the platform scales and learns what wellness modules actually work best, that software and educational content might honestly become more valuable than the clinical operations themselves.
Which brings us to Section 4, following the money, revenue and capital.
Now this is where it gets super interesting. When you hear subscriptions, you probably think of individuals paying a monthly fee. And sure, that's 35% of it, which is great. But actually, corporate wellness contracts are the secret engine here, pulling in 45% of projected revenue. Employers paying to keep their workforce healthy is the biggest and most profitable piece of the puzzle. Because a stressed workforce is an unproductive one, right? Smart companies are going to eagerly pay to give their teams access to this platform.
And investors, they absolutely love this. Why? Because it's beautifully asset-light. You don't have to pour millions into building physical brick-and-mortar hospitals to reach people. Your capital goes straight toward paying therapists fairly, acquiring customers, and maintaining the platform. That makes it a huge draw for health tech VCs, impact investors, and diaspora funds who want to see massive scale without the heavy, slow infrastructure costs.
Finally, let's wrap up with Section 5, risks and continental scale, expanding the horizon.
Look, no blueprint is perfect, and we have to be real about the risks. You've got legal risks, like protecting user privacy. You've got regulatory risks, as telemedicine rules keep shifting.
governance risks, which is all about ensuring top-tier therapist quality, and of course, founder risks, trying to balance this deeply human mission with the reality of building a profitable business.
But if you can manage those risks, the upside is completely phenomenal. Because everything is tech-enabled, one really strong platform can efficiently scale across multiple countries. You could start in Nigeria, tapping into that massive youth population and urban stress, and then rapidly expand out to Kenya, Ghana, South Africa, and Rwanda. All of these places are facing the exact same therapist shortages and seeing huge spikes in digital adoption.
And to really hit that continental scale, you need a smart cross-border strategy. Setting up a foreign holding company, maybe somewhere like Mauritius, doesn't just give you strong investor protection. It optimally positions the whole venture for a future private equity buyout or a big strategic merger. It basically creates this trusted, familiar structure so global capital can easily flow right into local African operating companies.
So here we are. We've uncovered the massive gap. We've walked through a brilliant, structurally sound solution that treats mental health just like a gym membership for your mind. The blueprint is literally fully drawn out, and the demand from millions of people is undeniable. The ultimate question now is, who is going to step up and actually build this institution? If you see the vision and you're ready to help build a healthier, more empowered continent, don't just sit on the sidelines. Reach out. Let's build this together. Thanks so much for joining me for this explainer.